Okay, so let's jump into my areas, my domains, musculoskeletal, neuromuscular. I can go on and on about how our bodies change from before and after baby, just as being a woman. I mean, think about it. Our body is one way before we get pregnant. Our body significantly changes across the 9 months during pregnancy. And then suddenly, boom, body changes significantly and very quickly at the end of pregnancy. How quickly our body changes is important when it comes to adapting and healing. It's easier to handle a slow, gradual change and harder to accommodate when the change, or harder to heal, hard to adapt as quickly when the change is sudden and quick. The rapid change that happens from pregnancy to postpartum is traumatic to your system. Forgive me for the lack of a better term, but it's traumatic. It's not surprising when our body does weird things in this phase. And a lot of it is out of our control. So we have to focus on what we can control, which I'm going to talk about in a minute. In the 9 months of pregnancy, the most evident physical change is weight and posture. So let's talk posture. As you know, your body has to stretch to accommodate for the growing baby. The main areas that are placed under a great deal of stretch are the abdominals, the connective tissue that supports the muscles, nerves, and fascia, the skin, and the supportive tissue around your pelvis and your hips. In an effort to maintain that balance, other areas will tighten, and this is often in the low back muscles called the paraspinals, some other muscles, and then also your hip flexors. For weight, now as you gain weight, pelvic floor, your joint stabilizers in your body, and your mid and upper back muscles have to work harder due to higher forces from weight. This is variable from individual to individual, and it is influenced by your lifestyle, but nonetheless, the principles are the same. Because of this weight change and where the weight is localized, we subconsciously adapt our posture and our movements as a way to conserve energy. And it's normal, completely, like that's expected. Hallmark changes that are easily recognizable are our upper back, which typically rounds. Neck posture as adapt goes forward. Shoulders roll forward. And then our low back arches more. And then we tend to walk and stand with our feet slightly wider than we did before pregnancy. This is no surprise because as the baby gets bigger, the baby gets bigger inside the uterus. There's less space in the abdominal cavity. Everything already smushed together is even more smushed, and things just, you have to accommodate. But everything that I just described, with the weight, with posture, this is all gradual. And then when you go into labor and delivery, boom, it's very quick. Now, when this happens, after your weight, your pelvic floor was forced to support the weight of the uterus, support the weight of the baby, your weight gain. Now it's on stretch, and it is yanked if your delivery is fast. So it's on slow, gradual stretch as it's supporting everything, and then boom, stretch even more very quickly as you dilate, and then as the last stage of labor occurs. The biggest change during this labor and delivery, like I said, is the pelvic floor and all the associated structures during the delivery. And these tissues can be stretched up to 3 times your original length. If your labor was fast, I mean really fast, it's typically more traumatic than those slow and steady deliveries. So that's why your nurse will try to slow you down if you're progressing quickly. And when I ask about someone's delivery, I don't want to hear that the delivery was either prolonged, and then they ultimately had to use instruments or something else, or they have pushed for a long time, and nor do I want to hear it was super fast. And here's why. You picture a muscle. Let's picture one that you're familiar with. Picture it under a stretch for a long period of time, and then imagine that stretch is yanked even further very quickly. That not only hurts, that hurts to think about it, but that's a muscle strain. Whatever courses through those muscles are also placed under the strain. The main tissues that come to mind to me are the nerves, the vessels. And in most cases, these tissues recover well. Our body's really resilient. Amazing capacity to heal and adapt. In the cases when the environment isn't suitable for healing, as I mentioned in previous videos, or we'll talk about in the upcoming videos, there are characteristic signs and symptoms that will suggest a particular tissue is more involved than another in your delayed recovery. Let me describe this in a couple cases. So case one, mom complains of vaginal pressure, prolonged swelling, vaginal heaviness, lower leg swelling, vulvar swelling. And she tells me that she had a lot of bleeding during the last phase of delivery, like after delivering. My thoughts immediately are directed towards the vessels. For some reason now, the sump pump, which you'll learn about later, or Google it, function of the pelvic floor and the pelvic floor vasculature is impaired, and there's pooling of blood now in the pelvis and the lower legs. Case two, then, mom complains of reduced sensation along with poor sense of when she has to go to the bathroom. During delivery, the baby got stuck in the birth canal for hours, and then she eventually had to get an instrument-assisted delivery. My brain immediately goes to, I want to test out the nerves based like sensation, see if certain reflexes are present, see if she's able to do certain things. Now, totally different picture, when no complications occur and there's only minor tearing, the body still needs time to recover. In cases similar to what I just described, healing is typically prolonged depending on the degree of tissue damage, which is hard to determine. And the reason being, it's hard to test. There's lack of ways to test beyond physical and subjective exam, like with your hand. So it's not easy, but every woman's journey is different, and therefore their recovery is different. There's no cookie cutter approach to a woman's postpartum recovery process. So a program should be based on healing principles, tissue adaptation principles, and then the goals of the person. Generally, muscle, skin, nerves, vasculature, and connective tissue all have different tissue healing times. I believe 6 weeks was selected as a woman's postpartum checkup before she's released to get back to life, because of existing research on healing timeline of the tissues that I just described, along with the uterus. But I think that research is pretty weak, and it doesn't acknowledge that getting back to life may mean competitive athletics in some women. As a rehab professional, I know that when a nerve is involved, the prognosis and time of recovery is prolonged. I know that muscles like the hamstrings take upward to a year to heal after a major strain, even though a person feels good to get back to their sport. And I know that connective tissue must be loaded in you got to hit the sweet spot of loading for it to adapt to a stronger tissue. I also know that underdoing it can result in adverse outcomes. Many issues related to weakness of some sort. So it's not, this isn't something that you're expected to be able to do by yourself, nor should you. You need guidance, and there's nothing wrong with getting guidance.